Everyone already knows how important it is to have a first aid kit. Chances are you do have one. You might have bought one at Walmart or the local store, a tiny little guy, and it's got some basics in it, and that's a great place to start. It's probably not going to be enough. I'm going to show you what I take in my first aid kit. I am a registered nurse, and this is my kit for the thru hike of the AT. Now, a quick disclaimer, I'm not a doctor. I am not an ER tech, I'm not an ER nurse, I do not have my wilderness certification, but I do know some basics on first aid, and I think what I've put together is a great setup for two. So this is what my first aid kit entails, so let's get into it. So first of all, with any first aid kit, first you should know how to use it, and you should know some basics of first aid. So if you haven't taken a first aid course, I would recommend that you take one. You can take the basics or one with CPR or a wilderness certification, but something to get you comfortable with the scenarios you're going to encounter and what to do about them, because knowledge is very important. Some people have some pretty beefy setups. Mine's pretty basic because I do want to keep it lightweight, but it is for two people. So my first part of the kit is the case it comes in. So this is just a little Dyneema bag. You don't have to even go this fancy. A Ziploc bag would be fine. But something you can easily identify and is going to contain all of your things is a great place to start. My whole kit for two is going to weigh about 8.7 ounces. So for some people that's way heavy. For me, it's perfectly fine. I'll carry that weight. My kit is basically designed with the activities and types of things I'm likely to encounter. So I'm thinking about things like foot care, sprains, wounds, any allergy issues, any GI issues, pain, inflammation. That's really kind of what I'm looking for. I'll have a few extra ideas of things that I can look out for that go beyond my kit, but those are things that I would have my Garmin InReach for, which is my satellite locator beacon, which I'll be carrying with me on me at all times. So that's not in my first aid kit, but that is part of my first aid setup. So let's get into it. So to start, we're going to talk foot care and blisters. So obviously with blisters, they're caused by a combination of heat, friction, and moisture. So make sure that your socks and your shoes fit really well. You have enough space in there for your foot to move around, but not so much that you're creating that friction. Some people like to wear two socks, like a liner socks, or toe socks, like those Injinji toe socks, I think are quite popular. I don't have a set of those. I just presently use one pair of Darn Toughs. I may think about trying another one if I start getting blisters. So if you get a hot spot, your best bet is to deal with it right away so it doesn't turn into a blister. So I use Leukotape for that. Some people will bring moleskins or bandages. Moleskin works better than bandages, but both don't really stay on it, particularly on the AT where it's wet. They kind of just wipe off, and then you just get the hot spot all over again. So I use Leukotape. I just wrap a small amount around a little pill bottle, which contains some medications I'll talk about later. So I'll use that. But if you do get a blister, start at a small one. It's best to clean it with some alcohol wipe. It helps to dry it out, and then put some Leukotape on it. Unfortunately, if you get a large blister, there is definitely some talk whether you should pop it or not pop it. I'm of the not pop it category, as it tends to be quite raw under there. It's a great place for infection. But if it is large and you need to walk, some people do pop it. I'm going to let you do your own research and decide what you want to do with that. I don't plan to pop my blisters, but if I can avoid them altogether, that's your best route. But if you do pop them, do keep them well cleaned. I would recommend putting some triple antibiotic cream on them to keep them from getting infected, keep them well covered and cleaned. So that's foot care. Also, obviously, I'll be keeping some nail clippers in there to keep my nails short, so I don't lose any toenails or have ingrown toenails, which can be a problem. A common issue for hiking are sprains. I tend to roll my ankle a fair bit, so I will use KT tape. I just have it rolled around itself and secured with an extra hair tie here so that I can brace my ankles or my knees if need be. I can also use this to, for any other issues that I have with regarding muscle support or joint support, so that's really handy. So I carry that. I don't carry any sort of tensor bandages or that type of thing. I'll use the KT tape. If you do get sprains and whatnot, it is always best to stop what you're doing, let it rest for a bit. You can take some ibuprofen. Sometimes you're going to need to use an ice pack or a cold pack. If you have a cool stream nearby, definitely put your foot in that for a while if that helps to help reduce the inflammation. But one little trick that I have is these small little silica packages you get with shoes and socks make great little heat packs and or cold packs. So the only difference is the temperature of water you use. So I'm just going to give you a quick demo. So put that little pack in a plastic bag, throw in some water. If you want a cold pack, make it cold water. If you want a hot pack for muscles, make it hot. Don't put too much water in because you have to pack this out. It is a chemical reaction. You don't want to leave that on the ground. You're going to zip it up and you're just going to let it sit in there for about 1 to 2 minutes. And I'll show you in a bit how that's going to turn. And it's a great little technique to use in the backcountry when you need a quick cold pack and or heat pack. And this is what happens. Really great. But pack it out because it's chemical and you really can't leave that in the bush. So next on the list would be wound care. Wound care is basically just going to be basic cuts and scrapes. So I'll be using, I have alcohol wipes or chlorhexidine wipes, which is a sort of an antiseptic wipe. These alcohol wipes are fine, either one. These do sterilize a little bit better, but they're not necessary. I carry a few bandages, really, that's it for the two of us, for just different sizes, and it's mostly probably going to be like knuckle scrapes because that's probably what will happen. Again, I have the antibiotic cream for those scrapes to keep them clean, or if I need to use gauze because it's bleeding or it's larger, I'll bring a couple of sizes, 2 2x2s and 2 4x4s. That's probably overkill, but that's what I have to stop bleeding. So hold pressure if you're bleeding. Don't be peeking. If you find a wound keeps bleeding, don't keep taking off the dressing, just keep adding more and secure it well. If it's a deep wound, you might want to irrigate it with a little syringe here. I just have a little 5 ml syringe. So you would fill it with filtered water, squeeze it in, make sure it's nice and clean, and then clean the area and dress it accordingly. If it requires something like stitches or it's a little wider, I have steri strips in my kit here, which I can cut down to size according to what I'm going to need. So these are really handy. I would dress most of those wounds probably with Leuko tape. I don't have athletic tape or other kinds of tape, but you could have that. That works just fine as well. To cut my strips or anything like that, I have, here we are, my little Swiss Army knife. It has a pair of scissors and a pair of tweezers, which are great for blisters, or not blisters, tweezers, which are great for splinters. And some people like to use them for ticks as well. Bug issues are obviously a problem. Ticks, we all know on the AT. People do have tweezers for those or little tick keys or that type of thing. I carry a tick key. I've used this before. I know how to use it. I would recommend that you do know how to use whatever it is you're planning for ticks because they're quite common. The likelihood of getting one is very high, and if you can remove it properly, that's your best bet because you don't want to get any of the Lyme disease or anything else that comes with ticks because it can be pretty horrendous. I also carry an extra lighter, although with Jeff and I, we both have one, so that's quite redundant. I'll be carrying probably not this big tube, but something similar to it, at least for the first little bit in Maine, where there's going to be, because we're going in June, there's going to be lots of bugs, particularly black flies and mosquitoes, and I'm tasty, so they're going to find me and eat me, and I'm going to need this. I forgot to quickly mention, with that gear, I do carry some gloves with me just to keep areas sterile, or if I have to deal with someone else's bodily fluids, it's always just best to have some gloves, and you know, they work well. The one piece I'm missing out of here is my needle and thread. I'll be carrying dental floss as opposed to thread, just mostly for gear repairs, because cotton thread probably won't cut it when it comes to like fixing a backpack or a tent or something. And on that note, I also carry a small repair kit for my sleeping pad and some tenacious tape for any other gear repair that is easy just to slap some tape on. There's some alcohol wipes in here, just because if you're going to use tenacious tape or gear repair, you have to make sure it's very clean, otherwise it's really not going to stick. Okay, so let's get into medications. I think we're all going to be carrying some. The basics, and probably the most used, is going to be ibuprofen, something like Advil, Aleve, that type of thing. This, in hiker parlance, is known as vitamin I. Try not to pop it too often. It does have side effects, but if you do have inflammation and muscle soreness, this is what most people are going to take. Make sure you don't exceed a maximum dose. And if you are of the older crowd, which I am, do be aware that this does increase your blood pressure. So if you already have hypertension, you might want to talk to your doctor and determine if this is the best choice for you, if there is something else, because there are other options. As well, anyone who has some cardiac issues might want to talk to their doctor prior and just, again, find out if that's the best option for you. If you're just looking for pain relief, then Tylenol or acetaminophen is probably your best bet. Again, know your maximum dose. It's 4 grams for Tylenol, but that might change depending on whatever kind you take. I take some extra strength in here because I can take fewer of them, but great for muscle pain. I also carry with me some allergy medication, so some Benadryl in here. This is great for things like poison ivy, anything itch related, bug bites, that type of thing. I am sensitive to bee stings, so I will take those for that as well. I don't need an EpiPen. Some of you might need an EpiPen, and if you have, bring it and try to educate the people around you how to use it and where it's located in case we ever need to get it out for you. Along with that, I carry some aspirin, 325 milligrams, and that's just as an in case. It works similar to acetaminophen, but it's used in case you think you're having a heart attack or have chest pain, because it does affect your blood clotting ability, or blood platelets specifically. But needless to say, it'll thin your blood out, and they tell you to take 325 milligrams, not enteric coated, in case you feel that, and then get yourself to some medical attention. So I carry it anyway, just as a in case, but I'm hoping never to need it, but I have it. Finally, my medication that I carry is some antidiarrheal, because nobody wants to have diarrhea in the backcountry, but if you do have it, you want something to take care of it. If you do have a lot of diarrhea, make sure that you're staying hydrated and replacing your electrolytes. So I will also carry some backup electrolytes in my first aid kit. I always have some on me, but just in case I need extra, I have it there, because you will lose a lot of them out through your waste if you have diarrhea. And if you have diarrhea for more than 48 hours in a row, go see a doctor, because chances are you have something else going on, and that might need to be taken care of. Something like a waterborne bacteria or norovirus. I know some people have mentioned being concerned about norovirus. If you are, it's only spread by contact and ingestion, contaminated food, so make sure your food is cooked well. The surfaces you eat off are cleaned, or you use something like a small cutting board. I just cut this from a large one I got at the dollar store and rounded the edges, and it's not in my first aid kit, it's in my cook kit, but prevents me from using my first aid kit, so that I also don't cut my fingers when I'm cutting cheese or salami or something. I tend to be a little clumsy that way. That being said, I also carry aqua tabs in case my water filtration system fails, or Jeff's fails, but the chance that it freezes at night and we forgot to bring them in our sleeping bags and they freeze, at least we'll have a way to purify our water until we can replace those. So I always take a couple of these. They weigh nothing, and it's better to have extra, particularly when it comes to your water, because you need water. In addition, it's not really medication, but it's an anti-chafe stick here, because we all have bits and bobs that rub and they hurt. if they rub too much. So this works really good for that. I think that's pretty much it for my gear. The other issues that really aren't specifically to an item for a first aid kit are just knowing some basic issues that you might encounter. So things like heat stroke, hypothermia, overexertion. Those are probably the three key ones that would affect a hiker. So heat stroke, getting very dehydrated, getting very confused, especially when heat and humidity are high together, because your body can't really sweat it out. So your temperature is going to go up. You might be short of breath. So kind of know your signs and symptoms for that. Again, with hypothermia, it's the opposite. It's when you're cold. So you're probably going to stop shivering because your core has gotten too cold. Your hands and fingers are frozen. Again, disorientation, dehydration are issues there. And you want to warm that core, get dry, get warm, those types of things. Know your weather before you start heading into something so you don't put yourself into a predicament you could have avoided is by far the best route on that. Finally is overexertion, which I think is probably a little more common than not for hikers on the AT, but it can lead to some pretty dangerous things if you let it get too far. Most hikers know to stop before they start really hurting themselves, but if you find yourself really pushing, and it's really, particularly if it's warm, but it doesn't have to be warm, but you're really pushing yourself, you've dehydrated yourself, you're finding you're getting extremely fatigued, and you have, particularly if you have dark urine, like cola colored urine, that's something you really want to be watching for, because that is a sign of rhabdomyolysis, which is sort of, it occurs when your muscle essentially eats itself. So you're breaking down your muscle protein and you're losing all your electrolytes, and that can lead you to some pretty dangerous places if you don't get that taken care of. So avoid doing that altogether by just stopping and not killing yourself for the trip, because it's not worth it. You will get there. Just take it slow, take your time. So if you found this valuable and you got good information, do give it a like. It helps the algorithm. And subscribe if you want to follow Jeff and I on our AT through hike southbound. And check out a couple of our other videos that we've got here, and hopefully you enjoy. Thanks for watching.